welcome everyone to the meeting hosted by the Senior. So welcome to Naomi Chitsa, who's just leaving office of the SPH at our university. Her research has an interdisciplinary focus that connects human rights with the right to health and occupational environmental practice in public health. And the project was supervised by Professor in London, So today she's speaking on the monitoring the implementation of occupational and environmental health as part of the highest attendance standard, which I think is the PhD thesis topic.
Thank you so much. Welcome everyone. Good afternoon. We're gonna start. I'll be talking, as she has already said, I'll be talking on monitoring occupational and environmental health as part of the right to the highest attainable standard of health. So this is actually an interdisciplinary research. So on the background, the exposure to environment and occupational health risks contribute to both communicable and non-communicable diseases, and that it's actually increased the burden of disease, the global burden of diseases in a way. So addressing these factors, which are environmental and occupational health factors, it actually offers opportunities to reduce the global burden of diseases due to communicable and non-communicable diseases. Burden of disease reduction and good health cannot be fully achieved through access to appropriate healthcare only, but we require a human rights approach to health that considers the underlying determinants of health factors. So the right to health is recognized in an international human rights law through many international and regional human rights instruments in the United Nations, such as the African Charter on Human and People's Rights, and in approximately 115 domestic constitutions, and including the South African Constitution as well. So, but however, it is mainly provisioned in the International Covenant of Economic, Social, and Cultural Rights, that is the ICESCR, within the United Nations Human Rights system. So up to date, to this current date, 170 states have ratified the covenant, including South Africa, which also they have ratified in 2015. So to determine whether state parties to this covenant are meeting their obligations, the Committee on Economic, Social, and Cultural monitors implementation of this covenant by state parties, which are state parties of the covenant as well. So when the state parties which are part of the covenant, they have got obligations to realize the right to health. So the first is to respect as the core obligation. The state must refrain from conduct which nullifies or impairs the enjoyment of the right to health. For example, adopting a national health insurance that discriminates against rural populations. And it also has the state parties also have obligations to protect. This means that state parties need to take necessary measures to make sure that the right to health is not abused by others. For example, they need to prevent those companies of dumping toxic wastes in all those areas which are not permitted. And the other obligation is to fulfill, which means that states are required to take necessary measures to ensure the satisfaction of health needs of the individual, which cannot be ensured by personal efforts or their state. For example, investing in programs to address social and determinants of health. So how does the committee monitor the implementation of this covenant? So basically, when the state party ratified the covenant, they are required to submit reports to the CESCR on how they are implementing the rights outlined in the covenant. And just after when they have ratified and they are now a state party to the covenant, they are supposed to submit the first submission in 2 years, and then after that they need to submit after every five years thereafter. So basically, at the first time of submission, they need to be required to submit after 2 years after ratification, then 5 years thereafter. Then after that, they need to submit this submission to the committee, which is made of 18 skilled experts in the human rights law. So, and these are independent experts. And this committee, their duty is to analyze these reports which the state parties are actually submitting to them. And then after having to analyze these reports which are being submitted by state parties, they actually issue comments in form of concluding observations. And then these concluding observations, they contain important issues and concerns that has been raised for state parties to attend to them and to act or improve on them. Any kind of reports that violates or maybe that have issues to do with the human rights in protecting, realizing, and respecting the right to health and other rights in which are covered in the covenant. So, and these should be addressed and reflected in subsequent report submission by state parties to the committee. So basically, after having to raise these concerns, state parties in their next submission, they're supposed to show how they have addressed these concerns and these kind of action they are required to improve on. So the covenant, this specific covenant, it actually have 4 articles, 4 articles in which the right to health has been provisioned in. That's why we had to focus. That's why our focus was on this specific covenant. So the state parties, they've got Article 7, which requires the state parties that they recognize the right of everyone to the enjoyment of just and favorable conditions of work, which ensures in particular safe and real working conditions. In Article 11, which actually talks about the right of everyone to an adequate standard of living for himself and their family, including adequate food, clothing, housing, and the continuous improvement of living conditions. This is also where the determinants of health are being covered. And also to improve the production, conservation, and distribution of food by making full use of technical and scientific knowledge, by disseminating knowledge of the principles of nutrition, by developing or reforming agrarian systems, and to achieve the most efficient development and utilization of natural resources. And this is also the Article 12, which talks about not health only as the achievement of health, but its highest attainable standard of physical and mental health. That's when we say highest attainable standard of health, we are now also referring to other factors that do not only include healthcare, but the factors all behind that include the aspect of environmental and industrial hygiene, the prevention, treatment, and control of epidemic, endemic, and occupational and other diseases. And also the Article 25, which also requires that nothing in the present covenant shall be interpreted as impairing the inherent right of peoples to enjoy and fully utilize freely their natural resources, wealth and resources. So that is where our environmental and occupational health factors are mainly covered in the covenant. So when we talk about, especially the Article 12, when you talk about the right to health in its attainable highest standard of health, it is actually mainly interpreted in General Comment 14, which actually says that state parties, they conceptualize health beyond healthcare and provide for the underlying determinants of health, such as food, nutrition, housing, access to safe, potable water, and adequate sanitation, safe and health conditions, and a health environment. And these are all interpreted in the General Comment. So also the occupational health risks should be minimized. This means that the state parties, which are parts of the covenant, they must take steps to prevent exposure to harmful substances inherent to work environment that affects human health. And state parties must formulate coherent policies that take preventative measures on health and occupational safety. And also health, environmental and occupational health policies, and also let's just say all health policies at large, they must be monitored and evaluated in collaboration with the civil society. So as the state parties have all these obligations to respect, to fulfill, and protect the right to health. Now, what happens if then they don't fulfill those core obligations? That's where we talk about violations of the right to health. So when they fail to enable rural communities to be properly consulted over industrial project, that is the failure to respect. And when the state parties, they fail to enact or enforce laws to prevent pollution of water, air, and soil by industry, that is where they are failing to protect. And also the failure to provide occupational health services for working population and universal access, that is the failure to fulfill. And then when the state actions of commission, that is deliberate or omission, passive or failure to act. So that is when we say now the state parties, the government, they are violating the right to health. So what was our study aim of this study? Our study aim. So our study aim was to investigate whether and how attention is given in the United Nations human rights system to environmental and occupational health factors in implementing the right to health. So that was our main study. So which point were we investigating on these issues to find out what was happening? So firstly, as we have already elaborated in that previous slide, that after the state party has ratified the covenant, they are required to submit reports within 2 years to the committee, which is called the CESCR. So what we did is we searched all the concluding observation, all the state party reports, which the state parties were submitting in the United Nations system under the ICESR. And then we searched all the reports which were submitted from our period of study was from 2009 to 2018. So it was a 10-year reporting period. So when a state party has ratified the covenant, let's say maybe in 2009, then we're going to start searching from 2009 up to 2018. That was our study period. So we started investigating at the first 2 years when the third party has submitted their reports to the committee. And then after that, we were also investigating at a point when the committee was investigating these reports, that is the concluding observations. And then after that, we would check to see on the subsequent reports of the follow-up reports, what did the state party submitted to actually answer what the committee has been saying. So we're also investigating those reports which were submitted in subsequent to the first ones. And then after that, we would also see after every 5 years, what were the reports which were submitted and what the state party actually included in regards to addressing or act in regards to what the concerns and everything that has been brought to attention by the committee. And then we would also remember we've got the civil society, because the state parties is supposed to address this every kind of conditions which they are required to meet for the right to health. So the civil society actually act as a watchdog to see if the state parties actually are meeting their obligations to realize the right to health in its highest attainable standard of health. So we investigating the civil society reports, state parties reports, and the committee concluding observations reports. Those are the point of investigation. So this was a mixed method study in which we include thematic and frequency analysis method to analyze our data. So as we have said already, that we were searching on the United Nations website where they are under the convention, the covenant. So in our search between 2009 and 2018, we managed to get a sample size of 61 reports. And of these 61 reports, the state parties reports had 21. We found 21 reports, and the completing observations reports, we found 18 reports, and the civil society organization reports, we found 22 reports. And our eligibility criteria was state party reports from countries which have already ratified the covenant, and also state party and the committee concluding observation reports written in English because we did not have time to maybe in other languages so that we can maybe translate to other languages due to time constraints. And also our civil society reports, which are also in English for the countries stated in the first, those submitting the state budget reports. So just to show the characteristics of the sample used. So as I've already said that we were actually searching from the 2009 as the initial state budget reports, and then we'll see what the committee said on in regards to commenting on those state budget reports. And then remember we said when the state budget submit these reports to the committee comments or maybe say anything that is needs the state budget needs to pay attention to. So now we had to look for the follow-up reports to actually see if the state budget took note of what the committee has already said. So these are actually the characteristics of the reports and the countries in which these reports were coming from. Because on the United Nations system, there are all countries which have like 170 countries which have already ratified the covenant, and we just randomly selected these countries but stratified by region because there are 6 epidemiological regions, WHO epidemiological regions which we use, and those are the regions which are shown on the left. And then from those regions then which we stratified with, we are now randomly selecting the countries which we were going to include in our study. So after doing all of this, and now we started doing a frequent analysis on our data. So on our frequent analysis, we found out that besides before we had the themes, because the themes we developed them after doing the thematic content analysis. But remember, when we did our frequency analysis, we're trying to see, we're doing a weight count to see how many of the kind of maybe occupational and environmental health words that were used actually in these reports. That was on our weight count analysis. Then this was actually, it will help in also formation of our themes. But remember, our themes were actually developed from the result which we got. So they were informed by the data that we got. So we realized that our first theme, we developed, I think, 3 themes from the data. And the first one was healthcare and social determinants of health. So on the healthcare, we have realized that 75% of the third party, the concluded observation and the civil society reports, they refer to health issues as mainly in terms of healthcare. So that was mainly when they're talking about health, the right to health, they were only talking about healthcare. They did not mention, the mentioning of occupational factors, environmental factors was less compared to the health, referring health as healthcare. And then majority of state parties, they showed improved provision of healthcare. So basically, the committee found out that in these state party reports, they were even acknowledging that, okay, the state party actually they're actually providing the healthcare to its community. And also they noted the improvement in accessibility, availability, and quality of the healthcare provided by the state parties, even though there were some issues, minor issues of discrimination, that maybe people in the rural areas, they were not getting as much kind of quality health as those in the urban population. But regardless of all these, they've been noted by state parties and also been noted by the committee. Social determinants of health in regards to economic, environmental, occupational health did not improve like throughout the 10-year reporting period. For example, these are the codes on our themes. These are the kind Oh, sorry. Yeah. I'm sorry about that. My apologies. So this is what I was talking about. So on the social determinants of health for environmental occupational health, which did not improve, we found this kind of codes which was actually pointed out by the committee. So in one of the reports, the New Zealand report on the 2018 report, which was also in response to the state party report, which has been submitted earlier. So we found that the lithium exploitation on indigenous lands affected by water quality, where other communities had no running water, over 30% without storage services. So these are actually environmental factors which could have been mentioned by the state party to show that, okay, regardless of the healthcare, the medicine, and also maybe attending to patients, what were they doing in regards to exploitation of indigenous lands and all those kind of stuff. And remember, we also know that health is a fundamental human right. This means it cannot only be defined not only in the absence of diseases, but also in achieving the highest attainable standard of health, which includes all these factors. Okay, so dealing with our results, like I've already mentioned that there was, as much as the committee was actually noting that the state parties were providing this healthcare, but there were issues of discrimination, and also there was inadequate food due, and they all actually mentioned that it was due to famines, droughts, and fires. But when the state parties now were addressing these concerns and as a remedial action, instead of addressing what could be the root cause of famines or droughts and these fires, they were actually directly they addressing these problems through distributing of food parcels. And these were only short term, and that's when maybe the committee would see that the committee, in our analysis, would see that the committee would still continue highlighting that there is shortage of food. This needs to be addressed. But then instead, the state parties of addressing the environmental factors that is affecting the shortage of food, the famine and these droughts, they just, okay, we're gonna calm down the situation by providing the food parcels, which was not actually helping in making sure that everyone is enjoying the right to health at the end of the day. So our second theme was the development project and environmental injustice. So we found out that in these reports, which we have analyzed, that there was exploitation of minerals without informed consent from indigenous communities in civil society, by civil society organization reports, and also the committee reports. So basically, so in environmental health, when we go and exploit resources without informing and having consent from the people who depend on these natural resources, that is environmental injustice. And now we have found that, and in the environment in which these people actually depend on, maybe to grow food and for everything, for their sustainable livelihoods, then the community, they depend on the environment for them to make a living and to have their health realized. But now that there are these development projects which are coming either from international species, and then they would come and then exploit the minerals without the informed consent from indigenous communities. And we actually got from Argentina, the committee, it was complaining that Argentina was allowing exploitation of natural resources, and there was no consent of the local communities in that. So, and to show that even though the committee could actually pick this up on the first report and actually raising this to attention for the state party to act, still the state party would not provide any remedial action, or maybe whether it was deliberate or it was omission, we were yet to find out. So then that's when the committee was even saying in the following report, they would actually repeat the same issues to say that these environmental and occupational health factors, they are not being given attention, regardless of them being mentioned in the previous committee report. And then now, I think this actually speaks to the same thing, that the committee and the civil society reports, they were concerned on health impacts of exposures to these mines, which were also being allowed to exploit their resources without approval and consent from the indigenous population. So they were basically, when they go and do these mining activities, now the local communities, they were now exposed to poor air quality. They were now exposed to all, even the workers which were working those development projects and mining companies, they were now exposed to the chemicals that are coming out of the process. And also now the committee requested third parties to take action to reduce these exposures. But then still the third parties would see that in the follow-up reports, there was no clear remedial action that was provided in the third party reports. So our third team was the environmental health and occupational health policies. Since we've already seen that these things were actually from the data. So now we have realized that after all these results which we've been finding, so environmental health and occupational policy and inspection come out as the main theme, in the sense that there were national policies which they would actually provide for that. Okay, we have this policy that deals with maybe the national health insurance, providing medication and everything. And then we have these policies specific of the environment, but then of course, the committee did acknowledge that, okay, we can see that the policies have been formulated and they're in place, but then there were concerns of ineffective domestication of these policies and the implementation and monitoring of reported policies, mainly the economy, the environment, and occupational health. So basically, like we have already said, that 75% of the third parties that were actually referring to health as healthcare. This means even also on the policies, there were more emphasis on how they were maybe the health policies, how they were actually being carried out at the national level. But regardless of that, they needed to acknowledge that environmental health policies and occupational health policies, they actually contribute to the right to health as well, regardless of all other healthcare factors being met. But nothing was provided in regards to how are the national policy on environmental health policy being domesticated, and how are they maybe put in place, the legislature, all those kind of stuff. We couldn't find anything in our data. And also on the recommendation which was provided by the committee in regards to these findings which we also had, and also what the committee has been noting, they could not, we didn't see any clear benchmarks in timeframes in which this remedial action should be measured against. So they would say maybe this is the concern of state party needs to address, but that was it. There was no say, okay, in the next period, we need to see this, or maybe within 5 years, we need to ensure that the air quality is improved from this standard to this standard, or we need to make sure that there are reduced occupational health risks, or maybe occupational deaths. There was nothing as such in the reports. It was just a remedial action and no time frame and no numbers to say, okay, this needs to be done, and we have this kind of target or maybe an indicator to actually say what needs to be done. And after all these findings and these results, our conclusion was that we have actually put our conclusions in two parts. So the first part was just to conclude on the fact that we have noted, and it was predominant, that all the state parties were actually addressing healthcare in the aspect of the health is the right to health in only the healthcare, while ignoring all other factors, which we are all embedded in this determinants of health. And in all those 30-party reports which were given attention, and also the committee giving attention to environmental and occupational health, we have seen that still the committee failed to adequately acknowledge the importance to the right to health. They would say, okay, we have seen that there's lithium exploitation and the community around are being affected by the mineral mining activities, but they would not actually directly link how these activities are affecting the right to health. So that maybe we just assumed by then that was the main issue, maybe why the state parties in their subsequent report could not follow up and give emphasis to addressing that. And then we say, or either the state party and the committee, they were not following through issues previously raised, then leaving these concerns unaddressed. The state party submit a report stating issues, and then the committee find some problems with it, some concerns and matters which needs to be acted upon, but then there was no follow up in those concerns. Then that dismissed on that 10-year period, we could not see any of the issues being addressed. And then the state parties appear to have no one to hold them accountable. So regardless of us having to investigate the civil society organization reports, the civil society organization seems to also understand, unless there was a civil society organization maybe specifically for environmental and occupational health, other civil society organizations were just also going the route the state parties were going, seeing health as also healthcare. That's where we could see that the state parties would have no one to hold accountable, because civil society organizations were supposed to act as watchdogs to see if state parties are actually meeting all the conditions, including if we say all conditions, we mean the healthcare related and the determinants of health. But then civil society organization also could not effectively hold the state parties accountable for them in not adequately addressing all the conditions that are required for the right to health. So continuing to the conclusion, we have seen that this one I've already mentioned, that they are not confined to the right to healthcare only, but the underlying social determinants of health conditions. And therefore, we have concluded that by focusing on health as healthcare, because on our search words, we included occupation, environmental health, occupational health, and working conditions. These are our search words. So seeing that 75% they addressed health as healthcare, it is actually it's limiting, and it is actually limiting opportunities that are there, that are being provided in environmental occupational health to address underlying determinants of health. And it's actually limiting also the opportunities for state parties to address safe and health working conditions and a health environment for the full realization of the right to health as defined in the GC14, which you have said that is the highest attainable standard of health, and it includes the right to food, water, safe and a healthy environment, and all those issues. So addressing environmental and occupational health factors, it enables progress towards full realization of the right to health, because it provides sustainable opportunities to prevent diseases rather than just the provision of healthcare. And the governments, they must actually urgently address the cause of poor health by providing conditions necessary for realizing the right to health, and specifically environmental and occupational health factors, since we've already seen how the opportunities which they bring to address, to help governments realize the right to health in its highest attainable standard of health. And further research, however, is needed to assess whether the impact of lack of attention given to environmental occupational health in the context of realization of the right to health, and also if they can further research on how the committee can actually improve the monitoring of these state parties' obligations in terms of specific environmental and occupational health related conditions. That means if we can see more in the reports in the future research where they have to do with the right to health beyond healthcare, if we can see also occupational health conditions being mentioned and environmental health conditions being mentioned fully, that will be in further in future research that what we would like to investigate and see. And that was it. Thank you so much. Thank you for listening, and yeah.
Standardized the reports are, and whether the temp, is there sort of an existing template, and are there metrics in those reports that state parties have to report on. So I'll give you one example, like with the WHO, everyone has a integrated disease surveillance focal point person, and usually it's a scale that has to be scored from 1 to 5, and there'll be sort of line items listed, sort of how many, I don't know, surveillance officers do you have in the government, for example. So how standardized is the sort of report that state parties have to submit?
Okay, Prof. London will also help, but I'm going to answer according to my knowledge. So these reports, they don't have a standardized instrument, which but according to the covenant, they've stated that for the government, for the state party to realize the right to health in its attainable heights of standard of health, it should report according to these articles which have been mentioned in the covenant, which now the state party is a member. So once the state party now becomes a member and ratify that covenant, it means that it has to address all those issues according to the requirements of the covenant, which it is part of. So basically, when I was doing the research, I did not see a standardized template in which the state party to report on, but I think that according to the covenant, the state party is supposed to report on all those articles or all those requirements which have been listed in the covenant to address the issues that it pertains to.
I think it's one part was that, but the other, just out of interest, is now that we know, what are the next steps? How does one begin to, to, I guess, elevate these concerns to those, who can do something?
So, since we have seen that how is the right to health being is violated, so right now, as we know that either the state parties were, maybe it was a matter of omission or it was a matter of deliberate omission, as if they are just maybe leaving those issues unattended, and then deliberate, maybe they were just failing to address those concerns. So now that we know, in my opinion, I think that's where we need to have the policy brief to actually inform the United Nations Human Rights Network on what is actually happening and this finding. So they have got systems in place in which how they actually do follow up on the countries which are not adhering to the covenant in which they are part of. So that's how I can answer the question. I don't know if that is fully answered, Bro.
So South Africa has to report again. We submitted the report in 2017, so we need to submit our second report now. But I don't know if you noticed in the table, hardly any country sticks to their reporting down. So the UN system is very lax in that way. But at some point, South Africa will report again. And normally what happens is you can actually preempt the report by submitting something. There's some committee which looks at the issues. I don't know what the wording is. But for instance, I don't know if you saw, there was a picture of the Cornubia pesticide fire. So, as an example, you could write to the UN committee and say, look, here was a conflagration of a warehouse that was not licensed. There were no permissions given to store tons of pesticides there, nothing called fire. But that's a violation. So you can preemptively bring that to the committee's attention. And then when the government submits a report, you can put in the shadow report. Which is actually, the government's not doing what it says it's doing, or it's simply not talking about all that. And that's the way the system's meant to work. And as you could see, it doesn't work very well. But certainly, I think people should want to. Anyway.
Okay. So that's what I wanted to ask, because it seems to me that governments can narrowly focus on policy.
They will.
That we've got policy in place without really, and there seems to be quite a narrow interpretation where, like you were saying, that they almost miss the fact that this is an environmental issue or occupational issue. And so it seems to me that the voice of civil society organizations are very, very important in this process in terms of, I think, shedding light on those sort of broader determinants and understanding of the role of occupational environmental health. And I was just wondering what sort of engagement or how, so let's just say anyone can write, so the civil society organization report, is that a sort of bringing together all the voices of people who's written, or is there an engagement that says this organization will do it for the country, or, I mean, who puts together the civil society? That's basically what I'm asking.
So there are civil society organizations, like some they mainly to focus on environmental health factors or occupational health factors. They've got their own mandate to make sure that they are guiding the human rights and what state parties are obliged to, like their obligations. So those civil society organizations, like I've already said, they act as watchdogs. They are trying to see, okay, so now we are so they did not have any benefits by they actually advocate for the vulnerable communities and for all those that cannot speak for themselves. So it's an organization on its own, but obviously there's civil society, there are organizations which represent the vulnerable communities, those who cannot actually go and say, look, the toxic waste has been dumped by close by our communities, how can we help? So the civil society have got that word, like actors that watchdog, which they can see all these things, the abuses of human rights by the government, and put it like, make it known to the human rights, to the United Nations Human Rights System, so that they can act upon it.
Thank you for this very interesting presentation. I must say I'm not surprised by the findings, but more interestingly, I want to make 3 points. Firstly, were your findings any different when you tried to stratify high-income countries, industrialized countries versus low and middle-income countries, developing countries, in terms of how they address issues of occupational and environmental health? Maybe I'll ask the questions one at a time. Yeah, if that's okay through you, Shaina.
So when we're still doing our randomly selecting these countries, we actually considered if we select according to maybe the high income or the socioeconomic status in regards to that, then this means now we have to have another objective to find out whether is it maybe because of the economic status the country is the third party is able to realize what can I say, to provide the resources required for them to realize the right to health. But then as we go for that, we know that the covenant itself, the human rights network, it actually allows that if a country does not have enough resources, they actually required to for the international assistance in regards, as much as they are going to be realizing the human rights and the right to health, they actually can request technical assistance. So if they can see that, okay, the country do not have adequate resources, if it is a matter of income status, economic status, then they should actually request technical assistance. We should have seen this in our reports, but we didn't, to show that economic status was not an issue and could not deter or maybe determine how these state parties were actually realized. If the state parties could actually mention that, okay, we wanted to address, maybe we have got a climate change issue, we have got droughts, and it is because we have this kind of, maybe we're using coal and so we don't have any other source of energy, so we need a renewable energy sources so that we can reduce our climate change health risks. But then no state party indicated that. This means they did not require technical assistance in regards to addressing these issues. They were just maybe doing whatever they were doing, not considering whether they have the resources or not. They were just not aware or not taking note of the other conditions which were required for them to realize the right to health.
Okay, now, so then that follows up very nicely with my second point, which is that the conceptualization of ill health and its determinants, as you rightly posed, is that it seems to be fixated around healthcare rather than the broader upstream factors. In fact, WHO a few years ago brought out a publication which tried to analyze what are the attributable fraction of environmental factors in terms of disease burden and mortality. And it came up with a fact of about 75% of disease burden and mortality is related to environmental health factors. So this implies to me that how people conceive of health and ill health is the issue. And what you illustrated that it is across the board. It's not just government, it includes civil society and all of these other parties. So my question to you then is, how do you think one can communicate the importance of environmental factors, including occupational health issues, in terms of broader society, in terms of a better understanding of the determinants of ill health, disease burden, and mortality?
Okay. My first thought is that raising awareness. We need, so like when we're conducting research, we're trying to have scientific evidence to back when we're raising our awareness, because we can meet different stakeholders, the community, the policy makers, and the civil society organizations as well. So as much as we go and raise the awareness and educate them about how important, like you've said, the WHO has already an article in which they actually clearly indicate that this is the 75% burden which environmental health factors are bringing to affect the health. So now if we go there with our scientific evidence to inform and educate our communities that let's consider the broader aspect of health, and let's not only address the healthcare factors, let's see how we can address the root causes which are causing the illnesses. So firstly, it will be to publish as much as we can, like the policy brief of our research findings. Secondly, that's to educate our communities and also advocating for these, for environmental health factors, other factors which are not clinical factors, I think. I don't know if there's anyone who can also help answer the question, so.
We have more questions, which is related now to the third part, which is you communicated that community civil organizations, they seem to be, from my experience and observations, the fixation is a lot on environmental health issues. And when it comes to contending whether governments are doing what they are meant to do, the environmental health lobby is certainly visible and able to, on some level, bring governments to account for some issues in relation to environmental health. But when it comes to occupational health, that is totally absent. Okay, it's not visible. And what, as you rightly indicated, governments then put their own spin on why things are the way they are in relation to occupational health issues. And so the watchdog for the occupational health and safety issues is not present. It's not doing its bit. Historically, it used, the trade union movement was much more visible in 20, 30 years ago in raising health and safety issues. I don't see much of this happening in recent years. And so the question is, how do you think occupational health and safety issues can be made more visible the same way as environmental health issues, and more so both of them, in terms of this watchdog function from the civil society organizations?
Okay. My opinion would be that we have the International Labour Organization on all those the laws that pertains to occupational health, but none of these are actually effectively communicated even in the workplaces and in the organizations. So my opinion would be to start there, to use the policies which are pertaining to occupational health safety in our organizations, and so that even the civil society organization right now, they are missing that point, because they can see the policies are there, but the domestication of those policies from the International Labour Organization is nothing on the ground. So we would actually start from the national policies, how the legal frameworks in regards to occupational health hazards and occupational health, and then we can, if maybe they are civil society organization, we can actually want to act as watchdogs. Where are they gonna go if there are no courts to actually handle these issues of occupational health. Because now if they can see maybe there is violation of, or there is no occupational health that is being addressed, and maybe the employers and at work people are being exposed and there is no PPE, for example, and all those kind of stuff. How can we, as a watchdog, where can I go and voice out my concerns? If the country itself, the state body itself doesn't have to have the legal framework to deal with these matters. So I think it would start by having the legal framework in the domestic, at a local level, that address the occupational health actually in broad, rather than just laying out the labor and working conditions as a minor issue. Then I don't know what others think. May
I think it's a difficult.
It's a very
No one is expecting to know the answer.
yeah, it's just our thoughts.
Come on, with the answer yourself.
I just want to add that, I mean, I think from the compensation side, there has been some kind of media attention when it comes to mine workers and occupational lung disease, but everything just stops there after that. And the prevention part, which you are really advocating for, is not sufficient because, as we all know, workers' compensation, people already have the disease. And it's more about that right, which is obviously important in terms of their right to social security and that aspects. The fixation in South Africa appears to be more on that end of prevention, which is the tertiary prevention, rather than on the primary prevention aspects, which you are advocating for and emphasizing.
Can I just comment? So just to say that I think Naomi did a really great project because it was quite a hard project to do. And it's not a simple study. Lisa Foreman, who was the co-supervisor, is a South African who's in Toronto, who supervised another student doing a similar project, but looking at the right to health. So we discussed this idea of looking at environmental occupational health. And just bear in mind that the covenant covers all kinds of rights, education, all socioeconomic rights. So what Naomi was doing was picking up what are they looking at. And in fact, there's no standardized report, so countries can pick and choose which rights they report on, and that's what happens. I think Naomi's showing quite clearly that when countries look at health, they look at healthcare. Mohammed's added the point that even when they look at environmental occupational health, they're usually looking at environmental health as opposed to occupational health. How you counter that is civil society strength. I just want to say that there is a network at UWC, basically to the Dalai Institute, which is convening South African civil society groups around socioeconomic rights, and they convene the initial set of reports, but anyone can submit. So I know the Children's Institute, for instance, they have the whole network of children's groups, and they submitted on, well, the CRC, but also to this covenant as well. So basically, anyone can do it. Anyone wants help, the Dalai Institute network can support them. So occupational health groups, when you get together to put in a submission, would be fantastic.
Just strikes me just as a comment in countries where there is, I was just wondering whether the political landscape of the country is taken into consideration, because where there is gross repression of civil society organizations, we're really never going to get the full picture. And even South Africa wasn't in the sample, but the 4 big violations of rights that she put up, it seems we've done all of that. And even when it comes to something like healthcare provision, like we would argue we do have a policy on mental healthcare provision, but the life is to me, it's a total failure on provision of mental health care. So. Any questions of the people online? We can't see all the people online.
See.
If you stop sharing, so here we go. Any questions from the people online? Sorry, before we close. Quite a lot of people online. Please go ahead.
Yes, I just wanted to ask, thank you so much for that presentation, first of all. Often, we speak about environmental health, but we know it's very much linked to other health concerns. And I think in South Africa, very active. So I wanted to ask, what other health concerns did you specifically identify that could be used to promulgate these interventions, and push the government to act. To give an example, in Namibia, we had a hepatitis E outbreak that lasted from approximately 2017 until 2021, although it's not really clear if it's completely eliminated. And that was obviously due to lack of sanitation in urban areas. And that's just my question. What are you linking it explicitly, or you just speaking in general?
So when we're analyzing our data, we're trying to find, even though like any environmental health related illnesses as well, if there were reports of such, so that we can actually link to say that as much as maybe the state part reported these were actually since it was the right to health, maybe the state part indicated there was an outbreak of this disease, there was a pandemic, or maybe there was an endemic, or maybe they experienced this illness, or maybe a spread, maybe cholera or whatever, is due to the water, like the example which you have just said. And then maybe we would see how the state parties address that. But we never, it's in this study, we saw that it's either maybe the state party were avoiding, like deliberate, or maybe an issue of omission, even though like there were issues like that which were like in the state party, but they didn't report. Maybe our assumption was that maybe, or alternatively, it was because maybe they did not have solutions in place, or maybe they were not even thinking, okay, the root causes of this problem. But one thing which we have highlighted is the food and nutrition, the malnutrition issue, where state parties already indicated that we have a malnutrition problem. But then instead of addressing that directly and say, okay, let's maybe make sure that our agricultural produces are increased, and this kind of nutritional benefits which are being offered to families, they were just providing parcels and they did not even indicate the neutral value or content of this parcel. So this was one of a typical example which we can say, but for now, we did not see any specific issue or illness which was related to environmental health, which the state part highlighted, or maybe the committee commented on to say that, okay, we see you've reported on these issues, but what about the outbreak which is in your state, in your country? What do you say about it? So we did not see that.
Thank you. Any other questions? People online, anybody else? Okay, thank you, Naomi, very much for a very, very interesting presentation. Thank you.